Dear friends, this is Tom Olds. I am the CEO of Generations Healthcare, and I wanted to reach out to you at this extraordinary time. More than likely, you are seeing this message because you have or have had a loved one in our care. Let me say, we feel honored that you have chosen us. For over 20 years, it has been our delight and blessing to care for the sick, the elderly, and the infirm. Generations Healthcare was founded upon the belief that caring for these lives is a special and sacred stewardship. As you are well aware, our country and the world is facing a pandemic that we have not seen in perhaps 100 years. We are facing an enemy that cannot be seen and for which we are only now discovering defenses. It is a terrifying time for everyone, but particularly for the elderly. I can only imagine your anxiety. At the same time, I have been so impressed with the patience and understanding I have seen from our residents and their families. I want to assure you, I do not believe your trust has been misplaced. Please know we take our calling and responsibility very seriously. Nevertheless, we are healthcare providers, and although we do our very best to care for our patients, perfection is impossible. As I have always told our staff, we are in a most unique situation. We never close our doors, and there is never a moment we are not on call. There is no rest in the 12 hours between 5 p.m. and 5 a.m. We have to always do the right thing on time, every time. That is an extraordinarily big responsibility. A few more things I would like to share with you. Generations Healthcare is comprised of 28 facilities spread throughout California and Nevada. We have over 3,000 beds and 5,000 employees. Every day we serve almost 10,000 meals, deliver thousands of medications, provide hundreds of therapeutic treatments, clean 3,000 rooms, provide over 10,000 hours of nursing, and have tens of thousands of intimate patient interactions. And we love it. We love the challenge of being the very best we can be every day. We have teams that have worked together for many years, and as a result have developed very good systems and protocols. We work as a single unit and have regular communication with one another and share ideas and best practices and treat each other as family. Just this past week, nurses drove from our facility in Las Vegas to support one of our teams in Southern California because of the extraordinary pressure on our staff that we are experiencing due to this virus. I am proud to say there is no facility in our company that would ever let another facility fail. I am also very proud to say that our entire company, when ranked on the national 5-star scale, is 5 stars. I cannot tell you how unique and special it is to hold such a distinction, a badge of honor earned through the tireless work of our competent and dedicated clinical teams. Despite all of that, we are not immune to this virus. As I tell our staff, there is always one gate we cannot defend. There is always a back door through which this virus may enter our facility. Fortunately, we have held up very well so far. We have not been untouched, but mostly we have held up extremely well. Let's pray it stays that way. I do want to impress upon you how extraordinary our teams have been in all of this. I want you to know that we have superheroes in our midst. As I express to our teams, I am in awe of their courage and dedication. They, just like everyone else, are suffering with fear and anxiety about this virus. They are fearful for themselves and for their families, but they are also fearful about your loved ones. They are looking at the same dangers you and I are looking at, but they are rushing into the fire every day. They are there on the front lines every day for you and for me, but mostly for our residents. That is what they do. Unfortunately, we serve in a business where we seldom get pats on the back from the public media. But I want you to know the healthcare workers that serve in our facilities long before COVID-19. Having said all of that, I want you to know we are being extremely vigilant. On a daily basis, we reinforce our training and infectious disease protection programs. Our senior leadership team is working night and day providing timely updates, education, and programs to mitigate and isolate this virus. We have enlisted physicians and infectious disease specialists to help design programs and protocols which help us to navigate an ever-changing course as a result of this new virus. We are in constant communication with the CDC and the California Department of Health, as well as every county health department within the counties where we operate. We have purchased hundreds of thousands of dollars of protective supplies and equipment for our residents and staff. We are on this. But as I said before, there are gates and doors we will never be able to defend. So when this virus entered one of our facilities, we were prepared and acted swiftly to isolate and mitigate its effects. Again, I very much appreciate your trust and patience. I do believe when this is over, we will be able to look each other in the eye and say, we gave our best. We were there at our post when we were called by those that needed us the most. Please keep us in your prayers as you are in ours. We are caring for a lifetime.